Hi, I'm Thomas Miller, and this is where I highlight stories that you may not know much about depending on the type of media you are consuming. And in this episode, I'll be highlighting the American healthcare system. Let's talk about that. That's right, you heard me correctly. I'll be talking about the American healthcare system. And for those of you who have not watched one of these before, this is how it works. I'll give you the mainstream media, what kind of stuff you're going to hear on the mainstream media about the healthcare system, and then 2 videos from progressive sources, and then talk about the progressive side news, what you're going to hear. And the whole point of this is to give you the stark difference between mainstream media and progressive media. And trust me, there is a stark difference. Let's get started, as always, with mainstream media. So here's the kind of stuff you can hear from mainstream media on the topic healthcare, especially here in America. You hear things like, "Oh man, what are these people complaining about? They got a good job, so they got healthcare with their job." Or, "The prices are great, man. You get to pay really low prices for your drugs and everything. No negotiating is needed to negotiate prices because you are paying good prices." Or, "Your healthcare is really good, man. It's so good in this country. The private healthcare is so good. We don't need it to change it or get rid of it or put a Medicare for all into place because we're already doing good." Another thing you get here on mainstream media about this topic is healthcare. Why is everyone so uptight about it, man? In this country, we're doing fine, man. You can go in and get a surgery and, this and that, and you're going to be well taken care of, man, because we've got the best healthcare system in this country, in the world, man. It's so good. You could go in, you could this, you could that. There's nothing wrong with it. There's no surprise billing. I mean, why is everyone complaining? One more thing else you're going to hear about this from people like Tucker Carlson is, I just don't get what it is people are saying that we need to reform our healthcare system. The way I see it is we got the best healthcare system, and it's wonderful, and we don't need to change it. So that's the sort of stuff you're going to hear. So a quick recap is, it's fine, there's nothing to change about it, and it's not that big of a deal because you already have great health insurance. So why do you need to change it? So that's the kind of stuff you hear from mainstream media. It's all hunky-dory, there's nothing wrong with it, it's perfectly good. Before I go to the progressive news side of everything, I'm going to leave you with 2 video clips to watch, and then we'll get started. One will be from TYT, the other will be from Status Coup. Enjoy.
As we all know, the healthcare system in the United States is broken.
I'm delighted to be joined by Jake. He's an emergency room nurse
Well, I hope you enjoyed those 2 clips. To watch those videos in their entirety, I'll leave the links down below in the description. Check them out. And remember, educate yourself and make sure you watch all sides of every story. Because there's not just one side to every story, like mainstream media lead you to believe. But don't take my word for it. Educate yourself. So now, let's continue on with progressive news. Here's the kind of stuff you're going to hear on progressive news. The healthcare system is totally broken. I mean, surprise billing is an actual thing. There are people who will have to pay $700, $200 because this doctor's out of network. But they don't know that. No one tells them that that doctor's out of network, that they're not in their insurance network, or that part of the hospital floor is out of network. So you have like a $200 here and a $5,000 there, $4,000. It's really real, people. Surprise billing is real. And yes, they are working on a way to make that less of a surprise billing, but it's weak. It's very weak because if you go by air, you don't have to pay a surprise billing. But you go by ground, you still have to pay the fee for the ambulance. But it is better than what it has been. But it can be improved. We need to go to Medicare for all, man, because then everybody's taken care of. Everybody. And expand it to have dental, eye exams, low cost in drugs to be negotiated on by Medicare. And it'll also help the elderly people. If we expand that, it'll not just help the younger people, it'll also help the elderly. And then if we take it away and not have it tied to people's jobs, then if you lose your job or you quit, you're not going to have to worry about not having to deal with those medical bills. You could just focus on getting a new education, to learn new skills, to go for the job or apply for the job. You can take your time because you don't have less bills to worry about. So that's just some of the things you're going to hear on progressive news. So let's do a quick recap. It's, yes, we need to go to Medicare for all. It'll help the elderly if we expand it. It'll help with drug prices. And then there'll be no more surprise billing. People won't go bankrupt. That's the thing you'll hear. And yes, so we need to change people. So that's the thing, man. The call to action is tell your senator, tell your representative that they need to fight, fight, fight. And tell them not to let up, man. Say, hey, okay, you want to do so that? Then what I'm going to do is I'm going to pull back and not give you this. I won't give you any of that, man. Really hold that carrot, man. And go, oh, you want this? Well, then you got to give me this. You want this? You got to give me this. You got to tell, hey, I want this, man. And don't just go for half or just a little crumb. No, go all the way up, man. Go for the whole enchilada and say, no, I will accept anything less. Don't negotiate. Don't go up here and then go down here to the middle. No, because even then, we get nothing. And sometimes we go to nothing. So that's my call to action, people, is let people know in the Senate, your representatives, and the House, that you want them to fight hard. And if they're not going to fight, tell them that they will not be reelected next time they're up for re-election, or make it so embarrassing for them that they'll have to resign. Legally, of course. Well, that's all I got for today, people. That's the difference between mainstream media and progressive media on the topic of healthcare. I'll see you all in the next one. Peace out.